she speaking in full sentences?
Yes, she definitely does that.
You're just worried more about sort of articulation?
Yeah.
The devastated economy has put the health of California's most vulnerable at risk. Those who serve them are also facing a crisis.
Many hospitals across the state of California right now are facing financial ruin.
New legislation by California State Assemblymember Dave Jones will help hospitals stay in business and provide funding for children's health care.
This bill is designed to bring between $2 and $3 billion in additional federal funding to our hospital health care delivery system and provide additional funding to cover kids' health care needs as well.
Assembly Bill 1383 would take advantage of newly available stimulus package funds from the federal government. Right now, California only gets a 50-cent reimbursement from the feds for every dollar spent by Medi-Cal or Medicaid patients. That deficit is driving hospitals out of business. The catch? The state needs to provide matching funds.
This bill lets us take advantage of that and allows us to pull those federal dollars in at a time when we don't have state matching funds. So the bill creates the state matching funds by providing for a fee on all hospitals, which is then used as the match to bring down the federal dollars.
And these federal dollars will come just in the nick of time as California's safety net programs, including the Healthy Families Program for children, were recently cut to the bone.
So at a time when state resources are so limited, this bill will provide $320 million to cover kids and stave off many of the terrible cuts that we've just had to do to balance the budget.
At a time when California's healthcare system is on the brink of disaster, this legislation is a win-win for our hospitals and our children. But without the governor's signature, this bill will never become a reality.
If this bill is not approved, we lose the best opportunity this year and next to bring in $2 to $3 billion in federal funding for our hospitals. There are hospitals that are near the edge of bankruptcy. There are hospitals that have closed because they're not getting high enough reimbursement for all of the Medi-Cal patients that they see. So we'll see more hospital failures, we'll see further disruption of our hospital health care delivery system, and we'll lose the chance to provide $320 million in funding for kids' coverage. So it would be a disaster if this bill did not pass.
This report was produced by the Speaker's Office of Member Services.